Inside a healthy human brain, learning and memory rely on a continuous exchange of electrical and chemical signals. One of the most important chemicals driving this process is glutamate. It acts as the vital spark that allows our neurons to communicate and form new memories. But in the moderate to severe stages of Alzheimer's disease, that precise communication system breaks down. Instead of releasing measured, precise pulses of glutamate, the damaged neurons begin leaking it in uncontrolled, excessive amounts. This continuous flood causes excitotoxicity. Neurons are so heavily bombarded by glutamate that their structures degrade. The chemical meant to form memories destroys them. Blocking glutamate seems obvious, but shutting it off completely would shut down all normal brain function. This creates a direct conflict for physicians managing late-stage Alzheimer's. They must find a way to stop the toxic flood without disabling the communication network. Preserving an Alzheimer's brain requires a mechanism that differentiates between types of signals. It needs a way to filter the chemicals rather than simply stopping them. This is the primary role of memantine. It targets specific cellular gateways known as NMDA receptors, which serve as the primary binding sites for glutamate. Memantine's defining characteristic is voltage dependence. It functions as a biological bouncer that remains in place based on the electrical state of the neuron. When chaotic surges of pathological glutamate hit, memantine stays put. It blocks the NMDA receptor gateway, filtering destructive noise and preventing excitotoxicity. But when a normal low-level glutamate signal arrives to form a memory, memantine detaches, opening the receptor to allow healthy communication. By separating the pathological noise from the functional signals, memantine protects the physical structure of the brain while actively preserving the patient's capacity for thought. Because this drug modifies fundamental neurotransmission and stabilizes the environment of brain circuits, the clinical benefits are not immediate. Patients start on a low dose, which doctors then increase slowly through a process called titration. This gradual approach allows the patient's body to adjust to the chemical changes while maintaining tolerability. Physicians typically assess the drug's efficacy by looking for signs of stabilization or improvement over a period of weeks, reaching a full evaluation after roughly 2 to 3 months. When the medication stabilizes the signaling environment, the results are tangible. Families often observe improvements in a patient's daily functioning, their baseline cognition, and overall behavior. As the pharmacological impact on the brain occurs gradually, patient outcomes rely on sustained patience from caregivers throughout the early months of therapy. In clinical practice, memantine is explicitly deployed for patients in the moderate to severe stages of Alzheimer's disease. It is used when early-stage drugs, like cholinesterase inhibitors, are not tolerated or have reached their limit. In advanced cases, doctors may prescribe memantine alongside those inhibitors for added benefit. This chart shows exactly why doctors monitor kidney function during treatment. Because the kidneys clear memantine from the body, reduced function can lead to drug accumulation. As shown in the impaired kidney model, this can cause the drug to reach unintended levels. This accumulation increases adverse central nervous system effects. For the patient, this translates to heightened confusion, dizziness, and a significant risk of falls. To prevent these complications, doctors must strictly monitor or avoid combining memantine with other medications that affect the central nervous system, specifically opioids, benzodiazepines, and antipsychotics. Pharmacologically, memantine stabilizes the brain's signaling independently, but its effectiveness is optimized when it exists within a broader framework of care, including cognitive stimulation, safety planning, and dedicated carer support. Memantine is not a cure, but by filtering the chemical chaos of Alzheimer's, it provides patients and families with preserved daily function and extended time.